We're going to get started now. Good evening and welcome to the Fall 2024 A. Lindsay and Olive B. O'Connor Lecture. Thank you all so very much for joining us this evening. For those of you who don't know me, my name is Kim Smith and I am the chair of the School of Nursing here at Hartwick. I have been a member of the faculty since January of 2021, and I work primarily with the freshman nursing students teaching foundations and health assessment. I'd like to express our deep gratitude to the A. Lindsay and Olive B. O'Connor Foundation. It's through the wonderful generosity of the O'Connor Foundation that this evening's event is possible, and we thank you deeply. The O'Connor Foundation enables the School of Nursing to invite distinguished leaders and scholars in the field of nursing and other related disciplines to Hartwick College for lectures and workshop series each year. I'd like to also take a moment to recognize some people that are with us tonight. And when I call your name, will you please stand up so folks can see who you are? Ms. Amy Warner, Director of the A. Lindsay and Olive B. O'Connor Foundation. Dr. James Mullen, Interim President of Hartwick College. Dr. Laurel Bongiorno, Vice President of Academic Affairs and Provost. And I also want to welcome all of the other Hartwick College administration, nursing alumni, Board of Trustee members, faculty chairs, faculty, students, and staff. Finally, I'd like to thank the Nursing Events Committee so very much for putting this wonderful event together. You are amazing and have worked so hard to make this evening possible. Please stand to be recognized. The committee of one. Yes, I can't see back there at all. I would now like to introduce Maya McCann, who is the chair of our Nursing Events Committee and who will be serving as our moderator this evening. Maya is the assistant chair of the School of Nursing and an assistant professor. With over 20 years of nursing experience, she has served as a hospital-based educator for 6 of those years and has worked at Hartwick College for the last 3. She currently chairs both the Assessment and Evaluation Committee and the Events Committee. Maya is pursuing her doctorate in nursing education from the American College of Education with a dissertation in nursing faculty needs and training for students' mental health, a basic qualitative study. She holds a master's in nursing education from SUNY Polytechnic Institute, a bachelor's in nursing from Utica University, a bachelor's in psychology from SUNY Institute of Technology, and an associate's degree, 2 associate degrees in human services and nursing from Mohawk Valley Community College. She is an outstanding educator and colleague. Please join me in welcoming Professor Maya McCann.
That was quite the introduction. I don't usually blush. So thank you, Kim, very much. Hello, welcome everyone to this year's A. Lindsay and Olive B. O'Connor Chair Lecture. As Kim said, I am Maya McCann. I am the current chairperson for the School of Nursing Events Committee. In May of 2024, the School of Nursing Events Committee was deep in the process of searching for a fall lecturer. Lucky for us, we had the privilege of hearing Linda Tarr-Whelan as she had powerful words receiving her honorary doctorate from Hartwick College at the commencement ceremony. Her speech inspired many of us. It left faculty eager to hear more from her. Several colleagues purchased her book, and some, Kim Smith, even accepted new roles within the School of Nursing because her motivation inspired them. I wasted no time in reaching out to Linda after hearing her speak, and we are incredibly fortunate that she eagerly accepted the opportunity to come back to Hartwick College. Linda, a nurse with degrees from Johns Hopkins and the University of Maryland, is a global expert on women's leadership. She has served as Deputy Assistant for Women's Concerns in the White House under President Carter and U.S. Ambassador to the UN Commission on the Status of Women under President Clinton. Linda's career spans healthcare and government, including roles as Administrative Director of the New York State Department of Labor and President of the Center for Policy Alternatives. Her resume is both extensive and impressive. Linda was chosen as today's speaker because she has a vision that deeply resonates the same values that we uphold in nursing and here at Hartwick College. So when I did finally get in touch with Linda and we were discussing a topic for today's lecture, I had mentioned to her that I want to ensure that students take advantage of this opportunity, the opportunity to be part of a revolution in nursing and healthcare. I want them to know how important it is to be an active participant and to help shape what they want nursing and healthcare to look like in the future. She immediately and enthusiastically brainstormed topics, wisely choosing tonight's topic of more nurses at policy tables, the promise of better conditions for nurses, patients, and the nursing profession. Please join me in welcoming Linda Tarr-Whelan to this podium. All good things work very for.
Slowly, but I'll be there. Thank you. Well, good evening, everyone. This is a strange situation. As Maya said, you can't see a thing. So I can't see you. So wave at me and say hello. There you go. All right, all right. That's really good. Well, listen, this is a banner year for me. I have been honored by the college, as you heard, with an honorary PhD degree, and then invited to come back and speak here tonight. It's a very special occasion. I've had a chance to meet some of you in classes yesterday and today, but I'm really glad to see all of you here this evening. I had an opportunity to meet Amy from the O'Connor Foundation tonight at dinner, and thank you also for the sponsorship of this event. I didn't know your foundation before tonight, but I have a connection to the O'Connor clan. I don't think they're related, but my favorite uncle, Uncle Okie O'Connor, Donald O'Connor from Springfield, Massachusetts, and so he always talked about how important the O'Connors were, and now I can say for sure I've come to talk to the O'Connors as well. I wanted to start by setting the stage a long time ago. Nursing care and nurses have underpinned my entire life. When I was 4 years old, I was very sick with pleurisy, pneumonia, and who all knew what else, and was in the hospital for quite some period of time, long enough that I needed to learn how to walk again when I came out. And nurses were my lifeline as a little girl. Parents were only allowed to come for 2 hours every day. And my parents would stand across the street and wave to me in the hospital. So the nurses, you know, they were beautiful. Their white uniforms, their white stockings, their little cupcake hats. They looked like the angels in my Sunday school book. And I knew then I was going to be a nurse. I've never looked back. I've always been proud to be a nurse. And so as you can remember from my introduction, I've been a nurse a long time. I graduated from Johns Hopkins in 1960, before many of you, all of you, and many of your mothers were born. So it's been a long time. But as part of that process of being a nurse all this period of time, I have noted and appreciated the changes in nursing. I went to a 3-year school, a hospital-based school. Many of you are now in process of doing your clinical work, but ours was pretty much all clinical work. Very little of the classroom work, which has given you the underpinning. So it was a different education altogether. And the on-the-job training was pretty tough. I've often said I never worked as hard as I did as a student nurse because the hours were long. We worked a 45-hour week on the wards, and then we took all of our classes, and then we studied. We had a lot of fun along the way as well. So where we worked were big hospital wards. You've seen them in movies. You know, they had 8 beds on one side and 8 beds on the other side of the aisle down the middle. And so I was on a men's ward. I was still a probationer. We wore brown lab coats, brown stockings, not clear stockings, but brown cotton stockings, and brown duty booties, as we called them. Not very attractive, but you certainly could tell we were probationers. So I was supposed to give my first injection to a real patient, not one of my classmates, but a real patient. So I went and I said, "Mr. Jones, I'm here to give you your injection." And I was pretty nervous. My knees were shaking. And he said, "Well, that's good." And I gave him the shot. And then the men all started to laugh. It was a men's ward, and they were hooting and laughing. The whole place was in an uproar. And then he said, "Nurse, I'm Mr. Simpson. I'm not Mr. Jones." They had changed places to tease the nurse, the new nurse. Well, I have to tell you, thank God, it didn't hurt him. It wasn't something like he was allergic to or something like that. But the dressing down I got from my nursing instructor is still with me today. And I deserved every bit of it. But it was the kind of experience you never forget, that you need to be extremely careful. So now you're doing it with patients with, armbands, and you check and you see if the code is the same. Well, there's a good reason for all of that. And I'm the reason, actually, for all of that. So I'm not going to talk a lot about the bad old days. They weren't so good, the not so good old days. But we did do the Nightingale Pledge. Do you still do the Florence Nightingale Pledge? Well, if you listen to it carefully, it is to aid the physician in his work. Note the his, that's important. But now that's words, but it's not a subsidiary role for nurses. Now, nursing has become a full profession itself, which was not true in those old days. But, along the way, I met some doctors who hadn't gotten the word. The first day I was on the job as a registered nurse in Champlain, Illinois, I was fixing an IV. I told some students this today. I was fixing an IV for a person. I was sitting beside her bed trying to get the thing to run again. That was also difficult in those days. And the director of nursing called me down to the office, and she said, "Would you like to quit or be fired?" This is my first day. I'm looking in my nice white uniform. Hopkins caps were these little organdy things. And I said, "Why?" I mean, I was a good nurse. I knew I hadn't done anything wrong between 7 a.m. and 10:30 on this medical ward. I mean, other times there might have been some question. But at any rate, she said, "You didn't stand up when the doctor came in the room." And I said, "I am not going to quit over that. If that's what you think is important, you're going to have to fire me because I don't belong here." But it wasn't unusual. Hopkins was a school where the doctors and the nurses collaborated and worked together. But that wasn't true in a lot of the hospitals. So some of the things that I've thought about and seen as I've gotten older and done a lot of different things, as you heard, that the nursing profession has moved a very long way on research, on evidence-based care, on education, a lot of things. But I think there's still a hole, and the hole is the nurses are not at the policy tables in enough numbers to make our views and our knowledge and our evidence known and taken advantage of. So when I went to graduate school, there was a program, it's a similar, very small program today. Today's program is on debt relief for some nurses to go to graduate school who are going to serve in an underserved area. But when I went with a newborn baby, there was a stipend and my tuition was paid. And that made all the difference. I could never have been standing here, actually, without that. We were not in a position that that was possible. So how do we overcome a nursing shortage when there's no programs like this? How do we get educating more nurses? I'm from Burlington, Vermont, and both of our big nursing programs have waiting lists of qualified students who want to be nurses, but there's not enough nursing educators. And I don't believe that we're alone in that situation. So how do we do better? How are we going to make sure that there's more nurses? We need, there's a shortage of nurses. There's always a shortage of nurses. So I believe that we can't get there by expecting somebody else to lead the way. That nurses need to lead the way to changing where we are today. So this is what I believe will make a difference. Nurses must be at every policy table where decisions are made. Hospital boards, legislatures, policy organizations. We need to come out of the shadows. I hate to tell you, but that is where we are as a profession compared, to physicians or hospital administrators, and we need to be able to improve health care for our patients and our profession and our fellow nurses. So I'm going to talk about 3 challenges tonight. The first one is we simply don't have the strength. We have got to get more nurses engaged to stand up, speak out, and make a difference, not to be afraid to come forward. Relying on other people to carry our agenda often means that our priorities take a back seat. And I just saw this. The University of Vermont Medical Center is in Burlington, and I've done a lot of volunteer work there on various things. And there were not enough nurses for the emergency room. We got a lot of emergency patients. And so what did they do? They said, well, it's too expensive to bring more nurses on, to bring traveling nurses on, but we're going to give the doctors each an assistant to be a scribe and write down what the doctors are saying in the emergency room. It wasn't the problem. They didn't solve the problem that was really there. The problem that was really there was we needed more nurses. So that's number one. They've got to have more of us at those policy tables. Number 2, I'm going to talk about nurse-forward policies. I made up that term when I was trying to think of a way to talk about what's needed in healthcare today, where nurses are providing almost all of that kind of care. And one of those ways is maternal and infant services. They're rapidly declining, even closing. So I'm going to talk about that and why there's a crying need for policy champions and nurses that can step up and make sure that this is a country that has maternity and infant services. I'm going to tell you a little bit about maternity deserts, and I found out at dinner from Amy from the O'Connor Foundation that Delaware County, right here in New York, is a maternity desert. What's a maternity desert? No facilities, no birthing centers, in many cases, no prenatal care. And 1/3 of all of the counties in the United States are now maternity deserts. I taught maternal and infant nursing at one point, and I was a head nurse in a premature and newborn nursery. And I was shocked to find out this information. And as a professional nurse, I don't believe we can just be shocked. I think we have to be there. That's our second challenge, that nurse-forward programs need nurses to push them forward. And last, I'm going to just talk for a few minutes about I believe in the power of one to make a difference. John Kennedy famously said, one person can make a difference and everyone should try. So I'm going to talk a little bit about that and what that might mean for you and your colleagues and your career. So policy change is where we're missing, where nurses can do better to improve what's going on. So I have a frame of reference for you. At one point in my career, I was the Director of Government Relations for the National Education Association. The National Education Association represents about 2 million teachers, And that's about the same size as registered nurses when you include the retired nurses, almost the same number. There are other things that are similar. These are caring professions. These are female-dominated professions. And, what did they do? They realized that there were a lot of questions about education, quality of education, staffing for education, and so they got organized, and they are very powerful policy-wise. So instead of the chorus that we're getting, like we can't afford a bigger staff or we can't give more salaries to nurses, do you believe that? It's a matter of priorities in many cases. Nurses are not at the top of the list. Maybe a new MRI machine or something. But we have got to be there to make the case. So the number of the number of practicing nurses is actually 2.4 million now, and if you add the retirees, it's 4.5 million nurses. And so, we got strength already that we are not actually using. In addition, the American public trusts us. The Gallup poll on professions in the United States, nursing is #1 as the most trusted profession. Way ahead ministers, way ahead lawyers, way ahead of policymakers. And so we have the confidence of the American people. We have the numbers, but we need to get busy and move. Because when I say there's not enough of us at the policy tables, there are now 2 nurses in the House of Representatives for the United States. That's 100% more than there were before the last election. So there's 2 registered nurses. There's a Democrat and a Republican. As a point of comparison, how many educators? 113 at policy tables by being members of Congress. And that is, in addition, that's 85 in the House, 28 in the Senate, and 9 governors were educators. So when there's a discussion about educators, there's educators at the table saying, we know what needs to be done, here's what needs to be done. In fact, Governor Tim Walz, who's running for office, is a governor who is a former teacher. So that's the first policy challenge. If we don't have enough nurses at the policy tables, we have to do something about it. My research on women's leadership is the same research that has been done internationally, and it's been done by corporations, it's been done in other countries, that when you have 30% or more women at the table, the outputs are better. Not counting because they're there, but because that is a critical mass, a tipping point to take a look differently at priorities, to take a look at supporting each other. There's an echo chamber. You say something that's important, and instead of it just kind of falling on the floor, all of you in the back say, oh, yes, that's right. We have the research that shows that that is correct. So we need to advocate for change. We need to take policy positions ourselves and support other nurses who are doing this work. So it's about time for voting to take place. You'll be pleased to know I'm not going to talk about the campaign. No, right? That's a good thing. But I want you to own your own research. I want not only for you to vote, and I assume, is everybody registered? How many people are registered to vote? Just about everybody. When you go to the polls, it's not good just to be registered, you've got to go vote. When you go to the polls, bring another person with you. There are several hundred people in this room, I believe, so we could get to 400 or 500 people coming to vote because you all decided that you were going to do something about that. So there are issues where I believe we could make some really big impact. Not every issue, but I think we have a caring crisis in this country. A caring crisis means that the professions that provide care, back to my educators as well as the nurses, are in a dire straits, and families are feeling the pinch because of that. The need for caring is, to me, the centerpiece. It's not this the job that you do. It's not whether it's women's work or a women's issue. It is that caring needs to be done and who is doing the caring. It's a very contentious issue here. It is not a contentious issue internationally. And in my role as an ambassador, one of the things that came to me the most was how much we have to learn from other countries. Countries which believe that children, for example, are the future of their whole country, not just the future of your family, but of the country. So that is a treasure which must be taken very good care of. So we have a long way to go with regard to that. We're still a bit invisible, I think, in the policy world. Not when you're sick and you go to the hospital and a wonderful nurse comes and takes care of you, or you have a public health nurse who comes to provide services where you are, or a school nurse, or an office nurse, or a nurse educator. But that's not where the policy is really made. So to give up the invisibility, we got to work together. There got to be more of us than just one or two here and there. And my example is a wonderful example. From 1975, women across Iceland walked out for a day. They didn't have a strike, because that was too radical a term. But they walked out for a day. They stopped doing any work whatsoever. Teaching, nursing, salespeople, moms, grandmas. They didn't make dinner. They didn't do anything for one day. They took this day off. And so now, that was 1975. That's a long time ago, right? But what is different in Iceland started right then. Their first woman president was elected 44 years ago. We've never had a woman in the White House. The gender gap, which in this country has closed by less than a half a cent a year from 1969 to 1980 to currently, is 83 cents for every dollar. Theirs is 98 cents for every dollar. Women and men are almost earning the same amount of money. Now, I don't recommend a day off, although I must say there are years when I feel like our progress is so slow. I'd really like to see something like that. But I wanted to give an example of how far away we are from that. When I wrote the book, Women Lead the Way, I went on a very long book tour. I went to 30 states, 4 countries. I gave umpteen speeches and presentations. And one of them was at a very prestigious university, in, like more engineering and that sort of thing, in South Carolina, where I was living at the time. And that was a really interesting learning experience, because as we finished up, I always take questions and answers, and I will do that tonight too. But this woman stood up and she said, "Let me tell you my story." She said, "I am a physicist. I am the first hard scientist to ever be a dean of a program in this college." And she said, "I'm just back from maternity leave, and they appointed me to this big, prestigious committee of the faculty on what the university should be doing in the future." She said, "I was the only woman at the table, and I knew the chairman. I thought he had a lot of respect for me, and certainly as a scientist." And she said, I spoke up. And I said, "Well, one of the priorities we ought to be thinking about for the future of this college, which had 60% women students, and a faculty with a great number of women, and a staff with a great number of women, we ought to be talking about childcare. Our people are having a very hard time finding childcare. And so the need is great. Other colleges around here, less prestigious colleges, have college-based childcare." And so then the chairman spoke up, and he said, "Well, dear," how do you like that? "Well, dear, we have to talk about the important things. So when there's no echo chamber and you're not there in a sufficient number, what do? you can build a lot of support with the men who think the way you do, but in a Southern college like the one I was attending, that's a long haul, let's put it that way. So that's the first challenge that I said. You got it? We need more women at the table. We need a critical mass of nurses at the table. We need to be able to support each other to make sure that the changes happen that our profession thinks needs to happen. So now that comes to my second challenge to you, and I've called it nurse forward policies. Maybe that's a name somebody else knows, but it came to my mind when I was preparing for this. And nurse forward policies are simply the ones where nurses play an outsized role. There's a lot of things. If you are in the operating room, the surgeon's role is kind of important, and the nurse's role is subsidiary in many places, but not in maternal and infant care, particularly, preliminary care. So, and I was thinking about that, and the New York Times had a front page piece in August that said, this is the name of it, "One woman's death reveals the myriad ways in which social and economic factors endanger pregnant women in the United States." So I started to read it. It was written by a woman named Ronnie Rabin from Belzoni, Mississippi. The result of these factors is that American women are dying more than in any other industrialized countries as moms in maternal care. And pregnant women who are Black, African American, or Hispanic are dying at 3 times the rate of white women in this country. So that's just not right. And the author of the story wrote, but this is not the whole story. She said, I think this is the kind of place where we're crying for solutions that we know about. She said, what really happens is like the story of Harmony Ball Stribling. I hope you remember Harmony. She's no longer alive. She was a married woman with health insurance who was 8 months pregnant in Belzoni, Mississippi. She was scheduled to have a C-section in 5 days, actually, not even the next week. At midnight, on the 4th of July, she threw up and she said her chest hurt. And Harmony lived in one of these maternity health deserts. They had closed the hospital. They had closed the clinic. There was no prenatal care. There was no ambulance service that was available. So her husband drove her 30 miles to the nearest emergency room, and she didn't make it. She died from preeclampsia, which those of you who have studied this know is something that doesn't have to happen if you've got good prenatal care, if you get the blood pressure under control, get the weight under control. So as the author wrote, but the one set of problems that is crying out are these maternity deserts, including the county next to you right here. The public sees the issues of reproductive health, and I could say a lot, but I'm going to be good. They told me I should be good when I came tonight. But the public wants good reproductive health care. 70% of Americans, regardless of party, regardless of whether they're men or women, believe we should have, in this country, good maternity care. We should not lose so many women who are pregnant. That is, in fact, a scandal. So, coming back into this, I'm really shocked by these statistics. It doesn't feel right that the danger of having a baby in this country is beyond that of almost all countries in the world, not just industrialized countries. Our rates of death for African American women in pregnancy are greater than most of Africa. We've got work to do. So we're in a bubble right here. I mean, despite learning tonight about Delaware County, New York and Vermont are the top number 1 and number 2 for safety for maternity care. But Mississippi is not at that level. So nurses provide a lot of the care to be sure that moms live and babies thrive, but we have a lot of work to do. I do want to just sort of digress a second on those international statistics, because the Commonwealth Foundation follows what's going on in healthcare all around the world. And this country has 23 deaths per 100,000 live births. So this is the infant side, this is the mom side, this is the infant side. And so if you put the next 2 and 3 countries together, which are France and Canada, they only come up to half of that number, to 11 infant deaths per 100,000. So we're talking about preventable health. We're talking about nurses' health with early care for pregnant women. The CDC has just put out a report to say that there's a 5% rise in the number of pregnant women who receive no prenatal care, and there's an increasing number of these deserts. So Harmony's story, remember Harmony, she's no longer with us. She and her baby died when there was no care. But many of the hospitals are dropping these services because they're too expensive. Some of them are dropping them for reasons that they have a lot more elderly patients like myself who need care. But, 2/3 of the pregnant moms in Florida do not receive any first trimester care whatsoever. So I really hope that this example of Nurse Forward is something that you can think about, and maybe this may not be your issue. I'm not trying to say everybody's issue is this, but issues where nurses are needed, where nurses can make a difference, where nursing care is the answer, we've got to start taking the lead on that. I did see another article, this was in the Washington Post, it was about at the same time, from Arkansas. It says, this state calls itself the most pro-life, but moms there keep dying. The percentage of moms without health insurance is very high, exceeds that. There's no primary care. There's only 60 days of postpartum care. And moms and babies are dying. So what can we do about this? First of all, nurse forward policies we already know. We know what works. We know regular visits work. We know that having doulas work. We know that there's evidence-based home visiting programs around the country. When I was a student, we did a public health rotation, and in Baltimore in those days, every newborn baby had a nurse's visit, at least one. Didn't matter which neighborhood you lived in, didn't matter what else was going on, every baby had a visit at home from a nurse. And what did we do? Well, we weighed the baby, we talked to mom, we scheduled the next appointment, the babies that were in trouble or the moms that were in trouble, we got them appointments so that they could be followed up. And we, as nurses, were honored in every neighborhood in Baltimore. So right now, there's a lot of these programs developing again. I don't know when Baltimore stopped, but they did stop doing this. Well, so what do we know needs to be done? We need policies that can bring nurses into the homes to be sure that things are done right. Well, in Oregon, there's a big story that says babies don't come with instructions, but in Oregon, they come with a registered nurse. I thought that summarized this quite well, actually. So they have found these programs save all kinds of money. They save a lot of money because you don't have the same complications that you have when there's no care. They save lives because you don't have women dying or babies dying because they don't have any care. So it's difficult to do anything that is preventative in this country, which means that there's got to be some very active organizing around it. There has to be voices, there has to be people at the policy table inside where the decisions are made and outside to push to make things happen. So meeting the challenge of nurse-forward policies, and there are others. There's lots. I do a lot of work. I'm on the board of home health and hospice in our community, and that's another good, another good example. We were talking about home-based care for elderly people, and so people can be in their own homes. We are way down the line, this country. We're the only industrialized country that doesn't have an insurance program that provides health care at home for people who are elderly or disabled. So here's today's final challenge. I do believe in the power of one to make a difference. I believe that each of you has power many of you have not yet used, but could, to make a difference. And together, if we are to work together and be together and collaborate and cooperate, we can make a real difference. And boy, oh boy, we need the difference. I used just one example, but you know, this country has all kinds of problems in healthcare, and we're not part of the conversation. We're not making a difference. So I believe in the power of one, and you should too. One person can make a difference, and there's 1 + 1 + 1. Mahatma Gandhi said, "You must be the change you want to see in the world." I quoted Kennedy earlier about one person can make a difference and everyone should try. So have the confidence the American public has in us, have the confidence and commitment to educate candidates and policymakers about the art and science of nursing, present better answers from research about improved patient outcomes, and then make the issue real by lifting up the stories of real people that you have taken care of, that you know who need these services, so that it becomes real. It's not just numbers, it's people's lives. So Margaret Mead, who I admire as an anthropologist, has said, "Never doubt that a small group of thoughtful citizens can change the world." It is never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. So here's a small checklist of how you can make a difference for nursing, for the profession, for healthcare, and our own nurses who need attention. First and foremost is to vote, to always vote, to bring someone with you when you do vote, to make sure that the issues that you care about are on as part of the agenda. I told a class today that I talked to that one of my favorite places to go was, when on my book tour, was Bennett College in Greenville, North Carolina, sorry. And it was one of the first colleges for African American women after the Civil War. And voting was an incredibly important thing. It still is an important thing. And so they all dressed in white. The entire population of the school marched to the polls together. There was no way not to know that there were all these college women who cared about what was happening in that election. It was a powerful tradition, and they still do it today. So use your power of one. Advocate for issues that are close to your heart. With practice, you'll find that it's both exciting and comfortable to be actually engaged instead of just complaining and being a bystander. So this is what I believe. Nurses can make healthcare better. Nurses together can make nursing better. And nurse-forward policies can change lives for the better. Thank you.
Thank you, Linda. So we'd like to open it up to questions. I do have two students who are going to walk around with mics. If you do have a question, please wait for the student to come to you. And then if you wouldn't mind introducing yourself and letting Linda know what year you're in. To start it off while we're getting the mic settled.
Oh, I can see you now. Oh, that's great.
So I would ask Linda, one of the things that some of the graduates who've left have brought up to me is they've joined organizations who are getting back into shared governance, but they're hesitant to join those committees feeling that they don't have enough to offer yet as a new graduate, as well as to be overwhelming. What do you think the organization would get from a new graduate being on one of those committees, as well as what is the benefit to the new graduate to be part of that committee?
That's great. You all know about shared governance in hospitals today. It's a big program, particularly in university-based hospitals, and they are looking for nurses to participate. And I taught the nurses at the University of Vermont Medical Center who were on these boards. And so here's what I think a new student brings: enthusiasm for the profession, a chance to be the wide-eyed person who says, oh, really, all those people are dying here in my hometown? An opportunity to bring stories of what you're doing every day. Stories are very important. I mean, I told you some stories in my remarks. One of them I left out because I thought I was taking too much time. But when I was that 4-year-old in the hospital, and I loved the nurses who were there, I used to get every day a letter from Nutty the Gray Squirrel. Is that important? Yeah, it was. It really kept me going because my parents could only come a little bit. No one else could visit me. And it was many years before I found out that Nutty the Gray Squirrel was my father, writing those notes. So a little thing like that, I mean, that was a long time ago, but I still remember how powerful it was. So if you've had a patient that really touched your heart and you bring it up in the shared governance as a better way that we could deal with that issue, you will be listened to. You have to have the confidence to stand up. And, you know, it's not as scary as it seems. I didn't always give speeches and write books. When you start doing it, I think you might find that it's very powerful and that it gives you some satisfaction to be making a difference rather than, as I said earlier, just complaining. All right, we've got microphones in the back.
I see a question up here. You're at.
Hi, my name is Maria. Can you hear me? Maria Vazina. I can't tell you what year I'm in. Sorry. But in any event, I was just curious in that story you told when you were brought down to the supervisor's office, whether you were going to quit or get fired. What did you do?
Oh, I got fired. I said, you'll have to fire me. I will never quit over a stupid thing like this. And I had another job within a couple of days. You know, in most areas, nurses are in such short supply that it had others. The hard part was to call my dad and tell him. He was just finished the last tuition check. I was a first-generation college student, and they were very proud of me, and he had just finished the last check to tell him I'd been fired. And so when I told him the story, he said, good for you. So,
So I was also wondering, do you know Ruth Lubick?
Ruth?
Lubick?
No.
Because she was, you know, one of the starters of birthing centers and very famous, and in your generation as well, and did a lot in Washington, D.C., as well as the Bronx.
Well,
Maternal Child
I
Health.
really was very involved in the Death with Dignity movement when I was there. And so that came out of England. My husband is British, and that came out of England. And so I knew a number of the pioneers of that, but I wasn't doing this work at that point. So
Okay.
I have to look her up.
You have to look her up. Ruth
I
Lubick,
will.
yeah.
Yes.
Is this on? So I'm Gerald. I'm a senior here at Hartwick. And I understand that you say, and all of our professors say, that nurses can make a difference and that we need to fill the table. But how, as a new grad, can I fill that table? How do I get a seat in that table so I can make a difference now? What can I do?
Good. It's a very good question. And I would say that the first thing you need to do is to start volunteering for an organization that is trying to do this work so that you get your feet on the ground. Your head is not just in the clouds, but it's in with collaborating with people. And then say, we need more nurses here. You don't have any nurses on this board. We've got to have nurses on the board. And here's 3 people who would be good to consider as candidates for this. So you can start right away. What specialty are you interested in going into? What do you want to do? Psychiatry. Oh God, do we need nurses in psychiatry? That was my worst thing. I had a patient who ran away. I had patients who were having sex under the bed. That did not work for me. But it was a different time, I think, but I'm not sure. Maybe not, right?
Still the exact same.
Still
now.
there, yeah.
Those of you who have not had psych clinical yet, that's about it.
I was running after this guy who he thought he was Jesus to start with. And he's running down the street in Baltimore, in not a very good part of Baltimore, which is where the hospital was. And I'm running along after him, and I said, "You don't have any money. I have your money." That's what we were supposed to tell him. You know what? That was ridiculous. He didn't care about money. He just cared about freedom. So at any rate, some of the other people who are new, you're going to go through a program wherever it is you work in psychiatry. There'll be a program for new grads. And you'll meet the other new grads who are coming online. They might not have been from this school. They might have been from someplace else. And if you get together and you talk about what could happen, are you interested in being on this group? It needs to have nurses at the table. You will find that you're able to change what is currently a situation without the nurses.
Thank you.
Good luck. Don't have Jesus as a patient. Oh, don't be shy.
My name is Ariel. I'm a sophomore. Do you think that one of the ways that we can be more at the table is, this is just a story for me. I work in a hospital setting, and I have to say I have like the best nurses in the world, because every day they give you that encouragement. I don't know how many stories I heard, but even when I'm frustrated, they're the ones that say, someday you're gonna be that person to make that difference. Do you think that it's important to pay that forward every time? Because I know that even as a student, I have freshmen or I have high school students that say, would you have done it all over again? Would you have started nursing school again? And I say, in a heartbeat, I would have done it again, because of the type of person I was and because I feel like it's important that we need people to make a difference in this world.
Well, I like your answer very much. And one of the things about paying the forward is, as you move up, and you're already doing this, as you move up, you have the chance to help those who are coming behind, to mentor students, to mentor other hospital workers, to actually be a role model. And it sounds like that's one of the things that you are already doing. I'm glad to hear that the nurses that you're working with are so extraordinary. That's my experience too, that it's really a wonderful thing. And when you ask the first question about shared governance, that gives nurses a voice, and that is happening in many, many hospitals today. Because in order to be a magnet hospital, you have to have a full nurses governance program. And so they're beginning to give nurses voices, and then the question is, can you get yourselves together? Can you agree on some things? One of the things I was going to talk to one of the groups about today is consensus building, which I learned in the United Nations. You know, generally when we make decisions, and this is true nurses' governments too, you make a decision by 50% plus one, right? That one vote makes a difference. Do we do this? Yes or no? One person. Consensus means you got to listen to each other. You got to find out where people are. You have to see what would be a common denominator, not a negative common denominator, something that people could agree to. And so one of the things that you can do in the nurses' governance is use consensus, and that's beginning to grow, so that it's a chance to have a voice as the newest person who is at the table or in the nursing group at your hospital. So keep going, be a mentor. That's really very powerful. When I talk about women moving up, I talk about that more than nursing mostly, and I always say, if you get a chance to move up, open the door and bring somebody else up. Bring them up with you, because that's the only way you can change who's at the table. If you're at the table and say you get promoted, and you're no longer at this table, who's coming? Is it then a vacuum, or have you helped work with some other women and other nurses so they have an opportunity to move up?
Any questions? I've got another one for you. I think part of the reasoning, I see a lot of the new graduates, and some even graduates older than that, is a sense of imposter syndrome, that they don't necessarily feel that they were good enough in school or specialized enough, that they know enough to bring to the table. How do you suggest that they overcome that feeling of imposter syndrome?
Well, there's a lot of that. I had that a lot myself when I started out. It's not unusual. And here's what I think about the imposter syndrome. Take a look at who else is at the table. They're not always doing a spectacular job. They're not always as well versed as you are. So look, I deal a lot with women thinking about running for office, and they say, well, you know, I haven't done this, I haven't done that. And I say, oh, how about Congressman somebody or other? What is his background? Well, I don't know, he's a finance guy, I think, a lawyer or something. Perhaps you have more experience than that person does. So you have to open yourself to the idea that what you have is valuable. What you have is probably unique. What your experience is, your education is necessary and needed. And you gotta pluck up your courage and stand up and speak up. I tell you what you'll find. I mean, I didn't start like this. I went to nursing school like you did. I went to nursing school, a training program even. And when my first job was one that was like, it was just ridiculous to not stand up for a doctor and they wanted to fire me or I could quit. That was the big deal. This is ridiculous. I've got to stand up. And what I did when I stood up is, first of all, my dad said, that's great, which was kind of handy. But it said, oh, I can do something. I can make a difference. So when you have a chance to do that, do stand up. Take a chance. What's the worst thing that could happen to you? That you don't look as sophisticated as you had hoped you did? At the UN, I worked a lot with Kofi Annan, who was the Secretary General of the UN. Absolutely marvelous Ghanaian man who really got it, all this stuff about women's leadership. And I was sent by the president to go in and talk to him about the need for more women in leadership at the United Nations. And that's a challenging thing to be sent in. You know, I didn't train for this. I was appointed to be that position. So I went in and he said, now listen, Ambassador, he said, I really want to talk to you about this. I need your advice. And I thought, oh my God, you know, my advice? And he said, yes. He said, I come through the civil service at the UN. He was the peacekeeper person, a leader. And he said, and every time I have said to somebody, this position is going to be open, you ought to apply for it, he said, every woman has said to me, well, I'm sorry, I don't think I've had enough education or experience, or I don't have enough time, I have no way to do it, or I think I ought to go back to school. He said, never in my entire experience has a man said anything but, I'll do it, I'll try. And that's all you're expected to do when you get an opportunity, is not that you can be perfect, but that you'll try your best to do a good job, and you'll learn on your feet. Anybody else? Okay, well, thank you all very much. Thank you.
So thank you so much, Linda. I hope everybody is going to leave here inspired, and they're going to go see what committees they can join here at the college and then at their places of work. Before I leave you tonight, I do want to say there is one more announcement HCASM would like to just discuss quickly with everybody for a fundraiser. So can I have HCASM representatives, please? that mic's It's on.
Is it on? Okay, there we go.
Yeah.
Hi, everybody. So we're HCASN. We're the e-board, I should say, for HCASN. And I'm sure most of you have currently seen my face as well as Michael Perlstein's all over social media. So we wanted to come to you guys tonight and talk to you about an event that we're doing next Wednesday called Where's Pearly? So,
You're never gonna find me.
so, with that being said, Pearly, if you want to come down here and introduce yourself for those who don't know.
This is a long strut.
You got to build the tension.
So basically, in a week, Wednesday, October 23rd, from 5 to 7 o'clock, as most of you have probably seen, we're doing a campus-wide manhunt for Pearly. So the purpose of this event is to help raise money for our senior class, because every year we give a gift that is completely fundraised by Hartwick's Nursing Club. So we don't get help from anybody. So the goal is to bring in as much attraction as we possibly can. So this is going to be an event not just for Hartwick nursing students, but the entire campus, including staff and faculty. So we need your help to get the word out there. We have been doing as much as we possibly can on social media, but we need as many people as we can to come. So we just kind of wanted to talk to you guys to say, help us out, please. So we are going to be making a post tomorrow or Friday with a QR code to a Venmo, which is where everybody can start to pay. It's $5 to enter. And we have some really great prizes, including one we just picked up today, which is $100 to our bookstore on campus for anything of your choosing. So we have gift cards from Yellow Deli. We have gift cards from Ocul, the piercing tattoo parlor in town. We have gift cards from Wise Guys, Autumn Cafe. What am I missing?
So many.
Hoffman's Car Wash, Tino's, Golden Guernseys. We have books donated from the bookstore on Main Street. Oh, yeah, we have local artists donated some stuff. So any prizes that are not going to be personally won by those who find Pearly are also going to be in a raffle that you can buy a ticket for. So the first 6 people to find Pearly will be getting a nice, lovely little gift. So he is allowed to hide anywhere on campus. So it's going to be a very fun thing. So yeah, we just wanted to talk to you guys and ask for your support and help in this, because it's only going to benefit you guys.
Also, please follow our Instagram. We're HCASN. We're just HCASN at HCASN.
I believe so. Yep.
HCASN. I think we're HCASN Nursing.
Yeah, Hartwick Nursing. Yeah.
HCASN.nursing. Follow us and you'll see Maddie's posts. But last year we were able to get our seniors jackets, which was a big thing that they wanted for the last 2 or 3 years. And
we know they want them again. So.
Yeah. And the year before we got lunch boxes. So if you want to help your seniors, if you want to help yourself when you're a senior, we would love to see you. It doesn't just have to be nursing like Maddie said. Tell your friends in sports. Tell your friends in Greek life. Tell everyone.
Yeah, so we're going to kick it off starting at 5 o'clock at Stack Lounge on Wednesday. We also have new news that President Mullen has agreed to hide in the spring if we can get this thing rolling.
This will be the biggest event. Please come.
All right,
let's get this ball moving, okay, guys?
Thank you. So thank you again, everybody. Be on the lookout for that announcement. We appreciate you being here tonight.